The following is a paid program for the Infomed Network.
Welcome and thanks for joining us today on the Infomed Network. I'm Angela Blevins and I'm so excited to be with you today as we explore the ever-expanding world of aesthetic surgery. Our goal on the Infomed Network is to introduce you to some of the top aesthetic physicians in your area and give you insight into the technology and procedures that you wouldn't normally have access to. Patients as a whole are many times confused as to which procedures and technologies provide the best service for their particular needs. In the aesthetic world, there are constantly new breakthroughs in technology and procedures being developed by manufacturers and inspired by cosmetic physicians. Our team has a combined 50 years of experience in the cosmetic field, and we hope to share with you, through our selected physicians, insight into their world that could only be available with their participation here with us today. We are privileged today to have Dr. David Hansen, one of the top cosmetic surgeons in Beverly Hills. Hi, Dr. Hansen.
Hello.
How are you?
Great, it's nice being here.
Oh, we're so happy to have you today. I mean, you really are one of the top aesthetic surgeons in Beverly Hills. You've got to tell me how you got started.
Well, I was born and raised in South Dakota. I grew up on a farm, and with the farm ethics of hard work and long hours, I knew that it was going to help me become a physician because I always wanted to be a physician. So I held down 2 jobs while I went to college and medical school, and I put myself through school.
Nice, yes. So you went to medical school there in South Dakota?
Yes, I finished my medical school training there, and then I was fortunate enough that I could choose any place in the country I wanted to do my internship, so I chose Hawaii because it sounded like such a paradise.
Was it?
It was great. I did my surgical training in Hawaii, and then from Hawaii I came to Los Angeles, did my dermatology residency. I got board certified, and then I did a plastic and reconstructive surgery fellowship in Los Angeles, and then opened my practice here in Beverly Hills.
And you've been around for how many years now?
26 years.
In Beverly Hills?
Yes, I started, when I finished my plastic surgery training, I opened my office in Beverly Hills and have been there ever since.
I can only imagine how competitive aesthetic surgery is in Beverly Hills. The fact that you have been around for 26 years, this must say a lot about like how your patients feel about you, about your stature in this community.
Well, I've been very fortunate. When I started out, I was lucky that I had an instant patient population right away, and then just from doing patients, they refer their family and friends, and our whole clientele list grew, and we have a lot of celebrity patients.
We're just going to take a quick break here because we really want to get back to ask Dr. Hansen some questions about some of the procedures that have made him one of the top physicians in LA.
Don't put up with sagging jowls, a turkey neck, or unwanted fat any longer. Now you can turn back time and see amazing results in just 1 day with Dr. Hansen's Advanced Mini Face and Neck Lift. Transform your appearance with natural and lasting results. Take away years of wrinkles and sagging skin with Dr. Hansen's breakthrough procedures. Dr. Hansen has been at the forefront of aesthetic surgery for over 26 years and is known for providing the most natural and effective results. Give Dr. Hansen a call right now to schedule your no-obligation free consultation. See for yourself the difference Dr. Hansen can make in your life. Call today.
Welcome back. Today we have with us Dr. Hansen. He's one of the top aesthetic surgeons in Beverly Hills. Tell us a little bit about which particular procedures you specialize in.
Well, I specialize in the advanced mini face and neck lifts, which are done under local anesthetic. I also specialize in the tumescent liposuction with the microcannulas. I also do a few minor procedures such as the chemical peels, Botox, and fillers, which always supplement the facelift.
So you mentioned mini lifts for the face. These minimally invasive facelifts are really popular right now. I mean, I've seen the commercials for lifestyle lifts. So is that something like what you do or something different?
Well, both are done under local anesthetic, which is great because you've eliminated the general anesthetic, which is a bigger risk.
That's where they put you to sleep completely?
Yes.
Okay.
Doing it under local is much safer, and you can actually get a much better result. But what sets me apart from the other procedures that you may have seen on television is that I do more of a high quality face and neck lift, which tends to give a much better result. The reason is that we're doing it under local anesthetic, so the patients are more comfortable, they're able to sit up and turn so that I can give them more of a natural, dramatic look. Also, I do very meticulous suturing, which when you're doing a face, you want to pull the muscle and the skin back and have it sit in a very natural position, and you want it to stay and last. So with all the extra sutures that I put under the skin as well as on the surface, it tends to hold better and last longer. And the incisions are much nicer because they're very, very fine. I do very meticulous suturing, and we hide the incisions in the ear and way up high behind the ear, whereas sometimes when they're doing these 1 hour quickie lifts, where one size fits all, they can't do as meticulous suturing, and so they put the incisions in either in front of the ear or in obvious positions or obvious places, whereas I tend to hide them, so it's very difficult for people to know that my patients have even had a facelift.
Oh, wow.
Another advantage is the fact that we're doing it in a fully accredited, certified operating facility. It's not just a small little exam room. And the procedure, the patient's very comfortable. We take the time, we have the luxury of time because these procedures take several hours.
Oh.
It's not just, like I say, the 1 hour quickie lift. This is done in several hours, and so we can make the patient comfortable and they have a good experience with it. With the nicest incisions where people really see a dramatic difference.
Just a higher quality procedure altogether, and
Much
more
higher.
attention to detail.
Yes.
What about the downtime? How does that compare?
Well, the downtime with this procedure is about 1 week.
Okay.
Normally on a facelift, which has been done under general anesthetic for years, it usually has anywhere from 3 to 4 weeks downtime. And you're usually kind of sick for the first few days, and you have several weeks downtime with bruising and swelling and possible complications. But with this, there's much less complications, less bruising, less swelling because of the local anesthetic. It constricts the blood vessels, they have less bruising and swelling, and they're up and about, they walk out after the procedure, so it's a much quicker recovery.
It sounds like there are a lot of reasons to go with this type of procedure instead of doing the whole general anesthetic.
Oh yes, it's so
A
much
lot of
better.
advantages. Yeah, tell me about the pain that might be involved.
Well, it's minimal pain. Most of our patients, they're comfortable throughout the whole procedure, and like any procedure, there's discomfort afterwards, but with this, it's much less having the local anesthetic gives you much less pain afterwards versus general anesthetic.
Okay, and you talked about the surgery center. This is in your office.
Yes, a lot of doctors don't have their own surgical facility, so they either do it in the hospital or they go to a surgery center down the block. We have our own accredited, certified surgery facility adjoined to my office, so it's all done right there. The patients are comfortable, they get up and they walk out afterwards. They don't have to go to an aftercare facility, and they can just go home.
Wow, it sounds like a pretty easy experience for something like this.
Yes, it really is. We made it so much nicer, and they have a good experience.
So I understand you brought some pictures, and I can't wait to see them. Tell me about your before and after pictures here and some of these patients and what you're able to do.
Well, on this first patient here, this is a patient that had a dramatic result, and this is approximately a month after the procedure.
Wow.
She has a very bubbly personality, but you can see from her before picture, it didn't show through. And all we did is turn back the time on her, and you can see from her picture here, she just looks more bubbly, and her personality and her face all match now.
Yeah, these are dramatic. This is a dramatic result right here. I mean, this is years.
Yeah, and here's that same patient. This just shows from the side view. You can see doing with the face and neck lift, we were able to pull it back and look very nice and natural. And then again, you can see, even at 1 month, the incision is it's very hard to see, but as time goes by, they fade away, and they're very hard for anyone to even know that they've ever had the procedure done.
She looks happy.
Now, here's a young lady who just loved her husband a lot and wanted to do the procedure for him. And so we went ahead and did the face and neck lift on her. She had a great result, and we also did a chemical peel. So we wanted to lighten up her skin, get rid of some of the age spots as well, and soften some of the wrinkles. And so with the mini lift and doing the chemical peel, she had a great result, and she is so thrilled.
Wow, these are dramatic.
Now here's the same patient from the other side, just showing with the chemical peel you can really refresh the skin so nice. So we always try to recommend that with the face and neck lifts that the patients do a chemical peel or fillers or Botox as they need it as well, because it does help tighten the skin and make it more refreshed looking.
Yeah, there's a reason they call them age spots, right? So you've taken years off of her.
Yes, she loves her result, and so does her husband. Now, here's a gentleman that he didn't want to do a facelift, he wanted to do a neck lift. So what we did is what's called a midline corset platysmoplasty, which is a neck surgery where we make the incision under the chin, and what we do is we pull the skin toward the underside called the submentum or under the chin area, and we cut away the excess skin and muscle and suture it nice. So the only incision is under the chin where nobody sees. And what we've done is we've pulled the jowls down and we've tightened the neck up, and you can see it gives a nicer jawline and a tighter neck. And this is only one day. This is the very next day, just the post-op day, one day. So we went from this to that in one day. So it's such an amazing procedure with almost no downtime. He got minimal bruising. He was able to go to work in 2 days, and that made it really nice. And so for a lot of men who don't want to go through a full facelift, doing a neck surgery can give them a great result without having the downtime, and in one day they look fabulous.
Yeah, that's a big difference.
Now, here's a young lady who wanted to get her neck pulled back and her jowls pulled up and more definition to the neck, and that's what we accomplished with her. And so again, you can see that even at a period of 1 month, you barely see where the incision would be because we hide it in the ear and we put the incision behind the ear way up high so nobody can tell that she's even had a facelift. And this is just at 1 month. Can you imagine how great she's going to look at 6 months when you can't tell at all? And she's just very thrilled with that, and it just gets rid of all the little turkey gobbler neck that she had underneath there. And here's a lady that was developing more jowling and the fullness in the jowls here, and she's lost definition to her neck and to the jawline. So what we did was did the face and neck lift on her and just pulled the skin back and tightened the neck up, and she just looks fabulous compared to what she was before, and she's just thrilled that it just was enough to make a difference where she was happy with everything.
Wow, these really are amazing.
Now this other picture right here this is again a gentleman that elected to not do the facelift and just wanted to do the neck lift. This is an 80-year-old gentleman that had several heart attacks and was not really qualified for general anesthetic to begin with. So doing it all these are done under local. So doing it under local, it was safe for him to have it done, and it made a dramatic difference getting rid of his turkey gobbler neck and made a nice normal looking neck without the risks of any kind of general anesthetic. So he was safe to do that, and it just got rid of that to make it nice and smooth for him.
Oh, wow. Great results. Tell me a little bit about the cost of the procedures.
Well, they're very affordable. It's not an expensive procedure. It's very affordable, and we do have financing available.
Okay. Wow, these really are incredible results. We'll be back with Dr. Drhansen in a brief moment.
Don't put up with sagging jowls, a turkey neck, or unwanted fat any longer. Now you can turn back time and see amazing results in just 1 day with Dr. Drhansen's advanced mini face and neck lift. Transform your appearance with natural and lasting results. Take away years of wrinkles and sagging skin with Dr. Drhansen's breakthrough procedures. Dr. Drhansen has been at the forefront of aesthetic surgery for over 26 years and is known for providing the most natural and effective results. Give Dr. Drhansen a call right now to schedule your no-obligation free consultation See for yourself the difference Dr. Hansen can make in your life. Call today.
Welcome back. Dr. Hansen, your results build a quite compelling case for us that want to look better and feel more fit. And I know that liposuction's been around for like 25 years, but you do something different, this tumescent technique?
Yes, it's called the tumescent technique with the microcannulas.
Okay.
What it is, I do liposuction with the patients awake. We're talking like this the whole way through with the patients. They're comfortable, it's an easy procedure for them to go through. They basically walk into the operating room, we start an IV, we give them a little medication to help them be comfortable and relaxed, and then we do little pinpricks of anesthetic to numb up the areas. Usually they just feel like little mosquito bites, and everybody tolerates that very well. Once it's anesthetized, they don't feel anything. So they're just lying there listening to music or watching movies. We have actually a headset that they put on that they can watch DVD movies in to help take the time go by faster. And so they're just watching their movies or listening to music, and I'm working away on them. And the way we do it is we use small cannulas, which are called microcannulas.
And you brought some for us to see.
Yes, these are what are called a microcannula. It's a very thin little instrument. There's no big ugly incisions with this technique, whereas the old method of liposuction, you had big incisions because the cannulas were very big and brutal and had a lot of side effects and complications with them. With these, we use a needle to make the hole in the skin, so we just pop the skin with the needle and slide our little instrument through, so there's no stitches involved.
No stitches.
And we can put the holes anywhere because they're so tiny, they shrink up where nobody finds them. And we do a lot of bodybuilders, actors, actresses, models, and nobody wants to have ugly scars, so they don't have to worry about that with these little tiny cannulas. And it's not the big brutal thing you see on TV. This is more of a wrist movement, just moving the cannula around. And with these little instruments, you can get a much better result because the smaller the instrument, the smoother the result. And with these little instruments, you can get right up underneath the skin and get into the hidden fat pockets so you can make it very nice and smooth, and the skin can actually contract and tighten up much nicer with this. Now, to compare what the standard cannula, which a lot of plastic surgeons have used for years, is this big instrument like this. Now, many, many years ago, we did general anesthetic with the larger instruments 20, 30 years ago, but in a lot of physicians, a lot of plastic surgeons still use this old method with the general anesthetic and with the big cannulas. And with the big thing, this is what you see on TV, how brutal it is. This can actually puncture the skin or puncture an organ and have a lot of complications, and you get much more waviness and dimpling with these big instruments. It's not the finesse work that you need when it comes to liposuction, but there are a lot of physicians that still do general anesthetic and use these big instruments because they can suck the fat out in half the time with these big instruments, but they can't get the kind of results that we get with the very tiny microcannulas, which just basically look like little needles that go around and just make it very nice and easy for the patient to go through. And the big advantage of also doing it with this tumescent technique is the fact that the patient's totally awake. When I'm doing the surgery, I want them to be able to sit up, turn, stand, put them in all different positions, because you know when you lie down on the table, when you're lying down flat, your stomach goes flat and shifts to the side. And you can't tell if it's even or symmetrical, because if it's under general, the patient's lying there and they can't sit up, they can't turn. But with this method, I can just have the patient sit right up. They'll just sit up for me. We'll look at their tummy to see, make sure it's flat. I'll have them turn in different positions. I'll even have them stand up, because I want them to look good in all positions. I don't want them just to look good lying on the table there. I want them to look good turning, standing, sitting, and in all different positions. So with this method, I can really fine-tune it when they're standing up, and if we see a little area that's a little full or uneven, we'll just go in there and we'll just smooth it out right then, so that when they're done, it's nice and smooth in all positions. And because they're totally awake, they can do this without feeling any pain or discomfort at all. And then when I'm done with the procedure, we put them in a tight compression garment, walk them into the next room, get them dressed, and they're ready to go. So they walk in, they have the procedure done, and they walk out afterwards.
Wow. And I know that the American Society of Plastic Surgeons recently did a survey and found out that a large percentage of women would never get liposuction because they're concerned about going under general anesthesia.
Yeah, general anesthetic is the biggest risk you take when you do liposuction. So we've eliminated that completely, so we don't do anything under general anesthetic. It's all under local anesthetic, and so it's not only much safer, but you get a much better result because of not having to be put under general. Plus, under general, you get more bleeding, more complications, but with this method, it's all under local. You're comfortable, you're awake. You walk out after the procedure. The next day, you're up and about, walking around, running errands. You're back to work in 2 days. So in just 2 days, you're back to work.
Wow.
And you can actually get back to the gym in 1 week. So it's a quicker recovery, less complications, and much smoother results because with these little instruments, you can really get the best results possible.
Yeah, let's see some of those results.
Okay. This is a gentleman here. This is actually a police officer. He had the love handles, which most men have trouble with love handles, no matter how hard you exercise and diet. You can't get rid of those love handles. So what we did is we liposuctioned the love handles, and it just takes them off very nice. And his gun belt sat right here, so whenever he put his gun belt on, it kept sliding down. And so after the liposuction, then his gun belt would sit fine, and so he's very happy with that. This is another gentleman that wanted a six-pack abs, and you can't get that with the big cannulas. You have to use the small micro cannulas to sculpt the area. And so we took him, and he worked out every day of the week and still couldn't get his stomach looking better. So with the liposuction, you can see we started to give him the six-pack abs.
Yeah, he definitely has it now.
Now, here's a young lady who wanted her inner thighs done so that they were more sculpted and her legs would look longer and trimmer. And so we just did the liposuction on her inner thighs here and took a little bit off on her outer thighs. And it made a dramatic difference for her where she was very happy with that. Now, here's another patient that she had gained a bunch of weight over time, and she just wanted to look better, so we wound up doing 2 liposuctions on her, and we covered her, basically her entire body, and we sculpted her, taking her from a fuller figure to more of a thin, trim woman. And now when she works out, she can really enjoy the benefits because it's a really good motivator. Getting the liposuction really can motivate patients, because if you get to a plateau where you're exercising and dieting and it's just not going anywhere, that's the time you do your liposuction, because when you see a big difference, you want to work out more, and it really makes you, feel good about yourself, so then you work out even harder.
Yeah, you're right.
Now here's another lady that we did her back and her hips and her inner thighs, and it just changed her dramatically to get her to where she wanted to be, and it was so easy under local, and she was back to work in 2 days without any trouble at all.
Wow, these really are incredible pictures. They must be so excited with the results.
Oh, they really are, and that's why I love doing it. Every day is a great day to go to the office because I love doing what I do.
Oh, ladies and gentlemen, we're going to take a short break right here, and when we come back, we're going to get to meet one of Dr. Drhansen's actual patients.
Don't put up with sagging jowls, a turkey neck, or unwanted fat any longer. Now you can turn back time and see amazing results in just 1 day with Dr. Drhansen's advanced mini face and neck lift. Transform your appearance with natural and lasting results. Take away years of wrinkles and sagging skin with Dr. Drhansen's breakthrough procedures. Dr. Drhansen has been at the forefront of aesthetic surgery for over 26 years and is known for providing the most natural and effective results. Give Dr. Drhansen a call right now to schedule your no-obligation free consultation. See for yourself the difference Dr. Drhansen can make in your life. Call today.
Welcome back. Dr. Drhansen, can you introduce Carla to our audience for us?
This is Carla, our patient, that just 2 weeks ago we did a face and neck lift on her and a full body liposuction.
Wow, just 2 weeks ago.
Yes.
Well, welcome, Carla. We're
Thank
glad
you.
you're here. We get to see his work in person. Tell me why she was such a good candidate for these procedures.
Well, Carla had previously had an unsuccessful facelift elsewhere, and it didn't last, and she was not pleased with the results. And after talking with her, I knew that I could make a big difference for her and make a big improvement. And so we decided to go ahead and do the procedure. And I wanted everybody to see someone who's just had the procedure done just 2 weeks ago, rather than always showing great pictures at 6 months or a year. If you see what it looks like at 2 weeks, it gives everybody an idea of how magnificent this procedure really is.
Yeah, you look amazing. Wow, so why did you decide to have these procedures, and what does this mean to you personally?
Well, I was unhappy with how my neck looked. And so a couple of years ago, I had the lifestyle lift because I liked it because you didn't go under and it didn't take very long and little recovery time, but the results didn't last. And it also left me with a scar. When I put my hair up in a ponytail, I had this big wide scar. It seemed to be growing after a few months. So then I saw Dr. Drhansen. I was referred to Dr. Drhansen by one of my dermatologists at UCLA, who's actually a professor. And Dr. Drhansen also does it under local, and the lifestyle lift I had was very painful. And Dr. Drhansen, I was just lying down at the lifestyle lift. I was sitting in a chair, and it was kind of like being in a dentist's office. It's just a blank room, and they give you some shots in your ears, and then they perform it. It's done within an hour, and they do about 5 a day. And the difference at Dr. Drhansen, you're his the whole day, and you lie down. It's in a surgical center, and you're relaxed, and there's equipment if you need it, but basically he was just an artist. He's he's a sculptor. He uses the small cannulas for the lipo, and you stand up and he fine tunes. It's like he's doing a little sculpture.
Yeah.
So that's why I did it, and I'm just so happy that I did, because the day after, when I was still swollen, I put on a pair of jeans, and then they were loose. I was like, wow, and the swelling hadn't even gone down.
The next
one day. Yeah, the next day.
You already could see a difference. Wow, you must be incredibly happy with your results.
Yeah.
So Dr. Drhansen, you have some of Carla's before and after pictures to show us?
Yes, these are before and afters, and again, this is a side view from doing on the face and neck lift, and you can see how well she looks just at 2 weeks already. This is the picture from doing the front view, and you can see under her neck how she had a little fullness there with a little skin hanging, and afterwards it looks much nicer. This is her on her body liposuction, where we did her stomach and her arms, and you can again see this is only at 2 weeks result, and can imagine how great she's going to look at the 4 to 6 month period.
It just keeps getting better.
It just keeps getting better. And then here is, we did her entire back and her arms from the back side, and again you can see how great that looks with just at the 2 week period.
That's amazing. You look amazing, girl.
Go
Let's
ahead
see
and
him.
show it.
Wow. You must be so happy with these results.
Oh, I am. Yeah, it was so easy.
Oh, and we're so happy that you got to join us today. What a treat for us. For both of you being here, thank you guys so much
Thank you so much for
coming
having
and
us.
visiting us on the Infomed Network. And of course, thank you guys for joining us today on the Infomed Network. Please call the number on the screen to set up your free consultation with Dr. Drhansen. Achieving a more youthful appearance is just a phone call away. I got to see this.
Don't put up with sagging jowls, a turkey neck, or unwanted fat any longer. Now you can turn back time and see amazing results in just 1 day with Dr. Drhansen's advanced mini face and neck lift. Transform your appearance with natural and lasting results. Take away years of wrinkles and sagging skin with Dr. Drhansen's breakthrough procedures. Dr. Drhansen has been at the forefront of aesthetic surgery for over 26 years and is known for providing the most natural and effective results. Give Dr. Drhansen a call right now to schedule your no-obligation free consultation. See for yourself the difference Dr. Drhansen can make in your life. Call today.
The preceding was a paid program for the Infomed Network.